The bill on health care just passed out of the Senate Help Committee on party line. There's a good reason for that. The president set some goals. The president said that everyone should be covered, that if you like what you have, you can keep it, that we needed to drive down the cost of health care, and that it should be paid for. That bill gets an F. It does not cover any of those things. It's a tragedy because health care affects 1/6 of the American economy. In fact, it affects every single American. It affects every single business. It affects every single provider. This is the most comprehensive thing that we have ever addressed in the United States Senate, because we've never had anything that affected everybody. It's important that we get it right. That bill got it wrong. We tried through a long process of amendments to get it right. We had to do it through amendments because the Democrats drafted the bill. And I do remember in the election, they said we won the election, we get to draft the bills. But that's not bipartisan. The only way that we had any input was to do amendments. And we did a bunch of amendments to point out the flaws in the bill. And I hope people will take a look at that, and we'll talk about that some this morning, because this bill will not meet any of the presidential goals. We've had speed in the drafting process. We allowed the bill to come to committee with only half of it drafted, and later we got the other half. The reason the other half didn't come is because it drove up costs even more. We're talking about $1 trillion problem that this bill will cause, and it will cover less people. It's also a travesty for small business. I have some other people here that will cover a number of these issues, but the bill fails what it was set out to do. I hope there's still a chance to correct it for the sake of Americans. They need to have insurance. They need to be covered when they have pre-existing conditions. They need to have portability. We had 5 Republican bills that answered all of the things that the president said, all of the goals that we set out. And we had to do those through amendments, and they were virtually turned down. It was kind of the impression we got was that if it was suggested by a Republican, it has to be bad. And that's bad for America. You heard that what just passed out of committee on a partisan line costs too much, covers too few, and kicks people out of the coverage that they've got right now. One success that we had was Senator Gregg raised an interesting point from the Budget Committee that there was a long-term care provision in this. And the long-term care provision was going to provide $59 billion in extra revenue for us. Pretty exciting. An accounting trick, though. They only count the revenue that comes in because nobody could use the long-term care until after the budget window closed. At the end of the closure of the budget window, there's a $2 trillion cost. So we did have an amendment that we were successful on because I think they were embarrassed not to pass it, that it has to be actuarially sound, which means the premiums have to be higher on the front end so that it covers the $2 trillion in cost. That's just one example of a lot of things that are in this bill that drive the costs up. This does not have a downward curve spiral to it. There's a provision in there for health care prevention. Yeah, I guess you could call it health care prevention if you really stretch things. It provides a slush fund mandatorily each year of $10 billion. And that money can be used for sidewalks and jungle gyms and buying farmers markets. I guess that could be health care, but it's something that has been dreamed of for earmarks for a long time, and it's going to be instituted through this bill. We're going to drive doctors out of the system, and we're going to have a little thing called the government option. The way that fails is that we're going to have 119 million people that are going to be forced out of the insurance they have now into a government plan. In fact, if it's worked the way that I suspect it will be, everybody will be forced into the government option if that continues to exist. We also have something new in this bill called clinical effectiveness research. That's healthcare rationing. That's cost effectiveness, not clinical effectiveness. And we tried a number of amendments to point out whether it was clinical effectiveness or cost effectiveness. That's what the United Kingdom has. The United Kingdom has a system with quality of life year. That means the older you are, the less care you get. The older you are, the longer you have to wait to see a doctor, the longer you have to wait for tests, the longer you have to wait to get treatment. The people die. That's not the system that we'll buy in America. We cannot go to that kind of a system. We will not settle for our older people dying. We will not settle for long waiting times for anybody. We're not used to that. And it just culturally impossible. But that's just a few of the things that this bill does. So there's a long process yet. We hope that there can be some corrections in this, that it actually can move to some of the solutions that we had. I mentioned that there were 5 Republican plans, any one of which would have met those criteria. 2 years ago, I went on a tour of Wyoming, a 10-stop tour with my 10 steps for health care. It would have solved all of these things. It would have driven the cost spiral down. It would have covered everybody. It would have provided portability. Judd Gregg had one. Coburn had one. And I should mention that Senator Wyden and Senator Bennett had one too. All of those meet the president's criteria. None of those are used. So we appreciate this opportunity to bring our case to the nation, and we know that the American people already understand. They're understanding at a greater rate every day. And this bill will have to meet the criteria that's been set out by everybody because it affects everybody. Well, in the Finance Committee, nothing's going to be final until everything's final. There are a lot of proposals being thrown out for ways to pay for it. We have some criteria for how that has to work, and it cannot be at the expense of Medicaid and Medicare. And it does have to be paid for. That's always a difficult task. We want it paid for out of health care items, not paid for out of a general tax of the people. And that's a good possibility if we don't keep it to health care. Again, a lot of ideas there, and we don't try and negotiate those through this kind of a situation. But I'm hopeful that in the Finance Committee we'll have a better hearing than we had in the Help Committee. Actually, I don't think reconciliation's an avenue that can be used at all. It leaves holes bigger than Swiss cheese if they try to use that approach. I'm hoping that the Finance Committee bill will be more bipartisan. I appreciate the openness that Senator Baucus has had at listening and working and taking the time to try and get it right. I don't know if he's going to be allowed to take the time to actually make it bipartisan. If he doesn't, then the help bill will be the bill. I'm also very concerned about how the merger of the two bills will work. We did a pensions bill. That was a two-committee bill, Finance and Help Committee. We worked that through in committee, and then we had to merge the two. And when we merged the two, it took the approval of both the two chairmen and the two ranking members before the bill could be put together. I don't know whether that'll be the case on this one. I suspect that it won't in light of what we just did in the Help Committee. But how they merge and whether any of the provisions that we're able to put into the finance bill ever make it into the final bill, we don't know. But if this is going to be bipartisan, if the American people are going to be convinced that it will work, it needs to be bipartisan. It needs to have the support of about 80 people. That would show that we've covered the loopholes, that we've met the goals, and that it will work. If it winds up just 60 votes or 61 votes, it will be the most liberal bill that this country has ever seen, and it may do things that we will never be able to correct.